Hey everyone, my name is Amar. I'm with the Concierge Fitness, and today we're going to talk about rehabbing the knee, or just trying to get rid of any issues that you're having in the knee. Mainly, we're talking about that pain that you're feeling mid-knee. You know what I'm talking about, that thing that you tell people, or you tell yourself that it feels like it's inside, it feels like it's deeper. That's usually meniscus, or if you're feeling it up top, that's your patella tendon that's coming across over here, connecting to your patella right here. So usually, physical therapists or orthopedic manuals will say to strengthen the muscles around the knee, right? But the knee stability, right? Knee joint is a stable joint, is controlled by glute strength, right? This glute medius over here, TFL, all that whole complex, the whole hip complex, controls pulling the knee out, in and out. So if we can strengthen the glute, we can actually bring stability to the knee. And the second thing about strengthening around the knee joint, you'll notice and you'll ask yourself, I do a lot of knee extension, that machine that I do this, right? And you're loaded at the ankle. The problem with that is you're causing a lot of shearing force on the knee. You're loaded so far away from your axis, right? This is my axis. I'm loaded over here. As I start to get around here, my hinge joint, which is a gliding hinge joint at the knee, it starts to get a lot of shearing force right about into here, and then it has to shift around and come up over here. So what you're causing is this slide and then shift right here, and that's causing a lot of pain into the meniscus. Now, physical therapists, before you come up in arms against me, I understand that it's a useful tool initially in rehab, but for someone who is continuously trying to strengthen and be functional in their life, I don't recommend it for something to do consistently. Now, what to do for the ongoing process of strengthening the knee? Well, there's certain exercises that you should do that fall in the family of terminal knee extension and glute strengthening. So we'll go through those exercises today, and we'll see if we can actually attack this issue that you're having with your knee. So the first exercise, really simple. Let's first take care of the tightness that you're feeling in the quad. The tightness that you're feeling in the quad. So what I'm going to do, I have this TriggerPoint roller. It's a Quadballer. It's one of their original ones. I love this tool. Their newer ones have a softer midsection right here. It's okay. It still works. You can even grab a foam roller. You can grab a rumble roller. Whatever you feel comfortable with, whatever you have at your disposal. Even a lacrosse ball or a softball will work. But what we're going to do is we're going to relieve a lot of the tension out of the quad. So what I'm going to do is, my knee is right here. I'm going to go above my knee joint, so about an inch above, and I'm going to come up to right about here, okay? So I'm just going to grind that out into there. And what I'm doing is I'm putting a little bit of pressure. If I want more, I'm just going to lay down completely on it. I'm going to roll in, roll out. And now there's a really crappy part here, right? This is the trigger point section. So what I'm going to do is, there's a really, really bad part. I'm going to bend and extend the knee. And really, I'm just digging that out. And if you have really tight quads, like most of the population has, you're going to be seeing stars right about now. So the purpose of this is not to feel pain. If you feel pain, pull back a little bit. What happens with pain is that the body or the mind will actually start to lock up, and it'll start to resist that trigger point feeling that you're trying to get. So breathe, think happy thoughts, go to your happy place, and dig that out. So we're going to go back onto it right here. After a few passes, that muscle should be loosened up. We can now strengthen that. So what we're going to do is we're going to get a band and anchor it to a point right here. I'll show you that. I have these Rogue power bands. These are great. I love them. They've never failed me, and they have the perfect tension. They come in bundle packs. I think 4 or 5 cost like $50. Go ahead, check it out. Great bands. So I'm gonna take my band, feed it through itself. Now I have this. So what I'm gonna do now is I'm gonna have this right behind my knee right here, and this is a banded terminal knee extension. I'm gonna step back to where I feel some tension into the band. My knee is gonna be unbuckled. My heel right here is gonna be down. And what I'm gonna do is I'm just going to bend and straighten. I'm gonna go for about 20 reps. Don't let your hips rock forward with it. Keep your hips nice and straight, and it's literally just the knee. It's a small movement, but I'm going for this little section right here, okay? Right above my knee. I'm trying to pull the patella up and reteach the lower quad how to straighten the knee and give it some stability there. This heel should not be coming up every single time, so jam it right down and go for that knee stability right here. The second exercise, you're gonna grab something next to you to give you some stability. I'm gonna sit back into a single leg deadlift. You're gonna find glute, mid-foot pressure. So this little part right here where the arch of your foot is right there, that's mid-foot pressure that I'm looking for. So I'm gonna sit back into glute. I find glute right here. I'm gonna pop up just very slightly and back down. It's small pulses through the glute. And even about 5 reps in, I'm gonna feel that glute kick on. Clamp that foot to the ground, mid-foot pressure. Keep finding glute. Go for about 10 to 15 reps each side. Now, the third exercise, we're gonna have to go outside for. We're gonna do some backwards walking uphill. You can do this on a treadmill, or you can do this outside. Let's do it. All right, now that we're outside, we have a little hill. You guys can see this kind of going up the hill a little bit. This is the equivalent of walking backwards on a treadmill at about 1.7 speed and a 2 to 3 incline. And really what we're doing here is we're just trying to connect the dots between the knee and the glute working together. So kind of like that, those glute pulses and the banded terminal knee extension kind of pulling together into one exercise. This is something great to do if you've been running for a long period of time, marathon runner, sprinting, whatever it is. It's good to kind of pull things back a little bit to the back of the body and make the quad work a little bit harder to pull the glute back as well. So what I'm basically going to do is I'm going to take that back step, I'm going to drive into the floor, and I'm going to pull my body backwards. And I'm just going to go back, 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 back. After a while, you're actually going to feel the glutes and the quads working together, especially after you did those exercises over there. So the protocol is you're gonna foam roll and trigger point the quad, then you're gonna do the glute pulses or the banded terminal knee extension and then the glute pulses, and then you're gonna go on the treadmill or hop outside to a hill and you're going to do the backwards walking. This is something that's gonna help you in the long run. Not only something to do when you're in pain, but something to do especially when you're feeling good. I will say that any pain that you're having anywhere in the body needs to be looked at on a larger scale, meaning that there's a bigger picture going on behind your issues. So the knee isn't just caused by the knee issue or that one fall that you had or that one soccer game that you played. It's not just caused by glute strength or anything like that, and it's not just caused by ankle stability. It could be a combination of the three, and you need to understand that injuries are a compounded issue, meaning that it took multiple things to cause the injury. So it's going to take multiple things or multiple ways to fix it, and multiple tools and multiple exercises to fix it. It's not going to happen in one shot. Those 3 exercises that I just showed you isn't going to fix it right away. If it feels great right away, perfect. Keep doing them and look at other ways to make sure that it doesn't happen again. The body is a beautiful instrument and machine. Think of it as a series of highways and side streets, in the sense that when there is an issue or an injury, it's pretty much a traffic jam happening somewhere. So if I have a shoulder issue, it means that I'm not probably using my shoulder blade in unison with my shoulder joint, or my thoracic spine isn't mobile enough to handle rotation, so that when I have to do this, it's too locked up and I can't actually do that. So your body sends traffic elsewhere to places that can't handle the traffic, and over time, that kind of traffic jam buildup will cause an injury. So you need to understand where the traffic jam is, what's supposed to be happening in the body that's not happening. Is a stable joint not stable? Is a mobile joint not mobile? Are you stacking basically stability upon stability? Are you stacking tightness upon tightness? Look at different ways of your training. Take a step back, remove your ego from the equation, and look at how to become a fitness, look at how to become more proactive, and I'll use this word a lot, with your fitness and with your injuries. With these things, with this in mind, please understand that these aren't the end-all be-all of answers. If you have any questions, please leave a comment or message me directly. Again, this is Amar with Ascend Concierge Fitness, and thank you for watching.